Now, the World Health Organization chief met Democratic Republic of Congo officials, and that was to reinforce efforts in an effort to contain the spread of the country's latest Ebola outbreak, urging international support as well as strong community-led response to the outbreak. On Saturday, the chief arrived in the eastern province of Ituri, which is worst hit by a severe outbreak and is gripped by highly contagious hemorrhagic fever. Upon his arrival, the UN Health Chief hailed the resilience of the African country for overcoming past outbreaks of the disease.
As we know, DRC has faced Ebola before, 16 times, and has ended every outbreak, and this is the 17th. That history gives me real confidence.
Tedros said that the international community was helping the DRC government cope with the outbreak, which included an increase in financial support, and stressed that community ownership was very much needed in overcoming mistrust as well as false information.
Government's leadership, and especially with community ownership, we can stop it. These are the ingredients which are important, of course, with the support from the international community as well. So the issue is in our hands.
The Africa Centers for Disease Control and Prevention previously confirmed 1,077 suspected cases of Ebola in the DRC, which included 246 deaths. State services are largely lacking in Ituri province, where access is hindered by insecurity due to the presence of armed groups and militias. At the same time, neighboring Uganda has confirmed 9 infections, which includes 1 death, as it closed the border with the DRC this week and ordered a 21-day quarantine for anyone arriving from that country. In fact, no vaccine or specific treatment exists for the strain of Ebola, which is behind the current outbreak. The medical charity Doctors Without Borders has said that there has never been an outbreak which recorded these many cases in the first days after it was declared. However, CDC Africa has assured that a vaccine should be ready by the end of the year. Ebola, which spreads through close contact and bodily fluids, has killed more than 15,000 people in Africa over the past 50 years. The deadliest outbreak in the Democratic Republic of Congo claimed nearly 2,300 lives out of 3,500 cases between the year 2018 and 2020.